is on the right. And so Chelsea and Samantha are going to come out here. And what I'll do is I'll just kind of narrate what they're doing with the animals. They're just looking over their bodies, making sure they don't have any scratches that are new that we need to monitor. Make sure that their eyes are right, the body condition is good. And so, okay, please put in the pocket. So basically, I'm going to give him a physical examination, and I'm going to take a look at basically all the different parts of his body to make sure that everything looks normal. The first thing I'm going to do is to look inside his mouth. Just talk really loud. Oh. So I'm taking a look at his teeth. I'm making sure that his teeth. Now I'm not asking him to spin around, so that's something that he's doing all on his own. So I'm actually just going to give him a few seconds to think about that, and then we're going to try again. He should stay straight while I examine his teeth. So we're just going to go ahead and try again. We're going to take a look. So I can pull down the gum and get a nice good look at his teeth. Since he's sitting up nice and straight and loud at this time, I'm going to bridge him, and I'm going to give him some reinforcement in the form of capelin, a type of fish. That's on your other side, because I think the microphone's on this side. There we go. So I can also turn him around so that I can get a good look at the teeth on the top of his jaw as well. So dolphins do have anywhere between 80 and 100 cone-shaped teeth, as you can see. Now, as they get older, they do get worn down. So you can see that some of Pico's teeth have worn down a little bit. They have only one set of teeth for their entire life. I'm going to go ahead and take a look at his eyes. We want to make sure that they're bright and there's no cloudiness to the eye, and they do look nice and bright and alert. So that's go ahead. Get a nice good look at both of his eyes, which are actually on the sides of his head, so he can actually see well above and below the water. So now we're going to take a look at the top of his body, which is called the dorsal side of his body. So you're going to notice that he does have a blowhole. It is closed right now, but that's directly connected to his lungs, and that's where he's breathing from. Now, he's preferring to breathe a few times every minute, but he could hold his breath for up to 10 minutes at a time. So there was a good view of a breath. So I'm basically just taking a look at his body, making sure there's no break marks, which are bites from the other dolphins, no wounds of any kind, no odd discoloration. So far, he looks excellent. Dolphins actually do shed their skin entirely every 2 hours per place. It's not shed like snake skin, but more just like little bits and pieces come off constantly throughout. Curve it a little bit, look towards here, so we're going to go ahead and reset on that one. Oh, let's clean that up. Oh, yeah. We'll go the other way this time. And so this right here, this is his dorsal fin. So I'm taking a look at this dorsal fin as well. Now this is the fin that he's using for balance and stability as he swims through the water. It's made up of dense fibrous connective tissue, very similar to your nose and your ears. So it actually is unique in every single from one another. So this is characteristic of the. I can ask him to walk down, and I can get a look at the back half of his body as well. Right here we have his tail flukes. So none of these fins that I'm showing you have any bones inside. It's all just that thin fiber connective tissue. So now we're going to go ahead and take a look at his ventral side, or his stomach. Now that we've seen his dorsal side is looking good, we'll look at the other side. So the first thing you're going to notice is that his underside is a lot lighter in color. Now this is actually to help him camouflage. It's called counter shading. So if a predator were to look at him from below, this light belly is going to blend in with the light sky shining from above, whereas that dark back is going to blend in with the dark bottom of the ocean. Now these fins that you can see right here, these are his pectoral fins. These are the ones that he's using for steering and for stopping. They're also the only fins that they have that have bones inside. So if you were to take an x-ray of those pectoral flippers, you would actually see a short, tiny little arm and 5 their little fingers inside of it. Now, as we make our way down, checking his body, I'll also point out he has a belly. He was attached to his mom with an umbilical cord, and he is a mammal, just like us. Now, right down here, we have the genital area, proof that he is a male dolphin. Now, we have the genital slit here, followed by, if he was to be a female, he would have a line here and a line here, which would actually store the nipples where the females would nurse their young. So his ventral side is looking good. He's doing excellent for us to make sure to give him some nice excellent tap. And now we can take a good look at his sides as well. So you can see that Liko has been trained to voluntarily offer all these different parts of his body so that we can really get a good look of every part of his body to make sure that nothing abnormal is going on. We do this at least once a day, but to be honest, probably at least 6 times. So let's take a look at the other side. So the final husbandry layout that I'd like to show you all is probably one of the most important that we have here. This is actually known as our method. Now, the reason that this is so important is because dolphins are not going to, they're going to mask their symptoms if they're not feeling well. You can imagine if you're, one of the animals out there in the ocean, if you act weak and sick, it's going to make you easy prey. So what we do is we've built a very strong relationship with our animals, so they trust us enough to lay their tails loop right here in our lap, and we can actually take blood from these veins. Now, Liko's pretty dark in color, so it's kind of hard to see, but he does have veins that are traveling down his loop this way, and we can actually draw blood. Now, that's a really good way to tell if he's fighting an infection or anything abnormal. And that way we can take precautionary measures before things escalate too far. Excellent job, Liko. Well, that is a great example of, a physical exam that we do on our animals. Are there any last questions that anybody has while we're here with Liko? They're typing them, so we'll give them a second to see if we have any, and then we'll move on if not.